Dear friends, we are so happy to meet the great day today because we have finished 898 case of Puberphonia, and this is Saturday, 2nd July 2022. Here we are just analyzing the cases of Puberphonia in a separate manner with the guide of our MPhil students. Now we are charting all our cases, the 896 cases, and grouping it. We want to put the evidence to the world that so many cases of Puberphonia we are able to treat successfully, not by a treatment in the larynx or vocal cord, no surgery, no medicine, only the manipulation of the uvula. How it is a successful program we want to prove because the statistics are very important. We are aiming. So we are preparing the statistics of 898 cases with a group of MPhil students and a great help from our nursing tutors of a few of the medical colleges. They are very helpful in doing the work. So with that, we'll be able to bring to the society, to the medical fraternity, the statistics. That statistics will speak. I had a few conversation with my colleagues in London, Dr. Chandrasekharan and other people. What is your hypothesis? Definitely, many of the research are only on hypothesis. So whatever you will be able to prove correctly, that will speak later. So on this day, without any big issue, we are going to do hands-on training for ENT doctors on every Monday. We want to train the next generation of ENT doctors. So we want to select only 5 candidates at a time. Every week only 5 candidates because it is not a big workshop. It is not a gathering in a star hotel. In my hospital itself, Siva ENT Hospital, 159 Lloyds Road, Royapettah, Chennai 14, just opposite the ADMK office. 20 minutes travel from the Central Railway Station by bus and 45 minutes travel by a taxi from the airport. Patients are coming. This is really, the YouTube is helping us a lot. Our message is spread only by the YouTube and little about the Facebook. And moreover, word to word, the treated boys tell other people. So even though we have started 29 years back Puberphonia treatment, that time itself I don't know the importance of the Puberphonia. Now only slowly I am improving. Why means the result of Puberphonia is a devastation that nobody understands. When a boy gets Puberphonia, the parents are the first people never take it seriously because they are habituated to hear what the boy talks from the birth itself. So father, mother are happy with the Puberphonic boys. They are eating well, going, running, playing, getting good marks. But what happened to their body? What happened to their relation with the friends? What happened with their friend, the relation with the girls they meet? That causes the devastation. I am also trying so many methods, whether we'll be able to do it online. So far, it is not successful. Now, little days will tell us. Here, few researchers I am just thinking of doing it. Number one, the research with radiologists of my colleagues. Because so many theories are put forward, so many awards are given for the movement of the vocal cord and change in pitch. This is elaborately done. I accept that. But now, as far as I am concerned, or we are concerned, puberphonia treatment doesn't warrant a treatment in the larynx. It needs a treatment only in the uvula. So uvula movement I want to study MRI or ultrasound or some method by which we should be able to understand the movement of the uvula in words. This will definitely create a new atmosphere all over the world. Why we should follow only uvula manipulation for treatment of puberphonia, not a treatment for the vocal cords. Basically, the treatment is very simple. We can get the voice, but how to habituate it? Habituation is done by Pavlov's technique only. If you follow any method for 21 days, it will become a habit, that's all. And coming and asking me whether any training they need. Yes. So there are 5 methods we'll be able to tell them. Number one is train your voice just like an athlete. Okay? Train your voice just like an athlete. Many of them, see what happened, many of the playback singers, telephone operators, and the IT people, they are immensely working with conversation and convincing people and interaction with the people 24 hours. That is a job for them. And they say they are not able to do it continuously. So, but if we ask them, what is the exercise they are doing? No time. For doing exercise, no time is required, only mind, that's all. So train your voice just like an athlete. Learn how to talk. It needs a special technique. Don't use, overuse, misuse, or abuse. That is called phonotrauma. Yelling, screaming, loud talking, loud singing, loud conversation is a problem. Because, but your voice needs to be strong and attracted to the people. So, phonotrauma has to be avoided. So, number one, train your voice like an athlete. So, second one is phonotrauma, misuse, overuse, abuse should be avoided. The third thing is you should talk only on your own ability only. You should not go and shout and make it unnecessarily. It will become, you will have a wrong image. When you shout only, all people will hear and understand. This we usually meet with the teachers. Teachers will come and tell, I'm having more than 75 to 100 small children. If I shout only, they will understand. This, I personally feel it is a misconception. See, teacher, another class is also going on side by side. That teacher is not shouting. Still, he is able to score more marks, yet attract the boys. So, what is the secret? So, merely shouting doesn't create an impression at all. So, this how you get is you make your own recording of what you are talking, then you listen, then you will understand. This is called feedback technique. So, feedback technique is very, very important. So, if you know what you are having, what is your capacity of voice, then you will place your voice on your pace, your capacity. That many of them politicians used to come and tell me, I shout for so many hours, nothing will happen to the voice. It is definitely a God's gift, I can say. But we know many people lose their capacity as a leader when they lose your voice. Here, I want to tell, if it is puberphonia, not only your voice, your lady partner also you will lose. There is a difference between face to face conversation. When you talk face to face, definitely body image, body style, eye to eye contact, the movement of the facial muscles, what you think, everything they understand. So it may make them happy. But in phone conversation, what can happen is it completely damage Puberphonia boys' voice because they are not seeing the body. There's no face-to-face scene. So in telephonic conversation, they may recognize as a lady. This very well you can utilize a feedback mechanism. You record your voice and listen to your voice. See, there are lot of literature regarding asymmetry of the larynx. So, if you go to a ENT surgeon like me, I will see the vocal cord. The structure may be normal, but one vocal cord it may be smaller, thicker, different from other people. One, it is not coming and meeting anterior loading of the unsonate process. And surprisingly, there may be a split in the true vocal cord that we are having different terminology for that, sulcus vocalis. Olden days, we used to think even it is a true vocal cord. So vocal cord, just there are two striation codes, sulcus vocalis. In between a sulcus, a deep burrow is there. So these are all normal variants. But whether the medical field, they will try to understand normal variants are there. One vocal cord moves slower than the other. one vocal cord moves, bend. There is a gap in the vocal cord when they beat together. So these are the mistake they find in the vocal cord. That may be the reason for the puberphonia. This is what everybody had the feeling. It is correct. But they need not be the reason for puberphonia at all. The puberphonia means everything is mutated, everything is stopped. So this is originally told, right vocal cord and left vocal cord, the nerve supply is different. One vocal cord, the nerve supply, the laryngeal recurrent nerve comes directly. Another vocal cord, it is having a circuitous route. The length of the nerve supplying the vocal cord, right and left, different. Their strength is different, their length is different. So can't we feel that the movement of the vocal cord need not be similar? There will be a gap between the vocal cord when we talk. So this gap in the vocal cord or slowness of one vocal cord, thinness of the vocal cord, sulcus vocalis. Sulcus vocalis, they say there was previously a cyst was there, then it ruptured and it had become sulcus vocalis. It can be. We are not saying completely it need not be. But this need not give you a problem for puberphonia. Many of the cases out of our 898 cases, one vocal cord is thinner than the other. One vocal cord moves. There is a gap in between the vocal cord when we phonate, and the anterior slip of one of them, arytenoid cartilage, corniculate and cartilage may be more anteriorly placed. So these we commonly see, but if we treat uvula manipulation, the patient will get normal. And another is dysphonia plica ventricularis. See, so many structures are there in the larynx. When we talk, when we shout, when we scream, not only the vocal cord meets together, other structures also comes together. That may be a great tension in the vocal cord mechanism itself. There is a false vocal cord also is there above the true vocal cord. Sometimes the false vocal cord meets before the true vocal cord. Then what happened? It is called dysphonia plica ventricularis. So the voice won't be all right. There are many methods of treating for the same by ENT surgeon and speech therapist. But with this dysphonia plica ventricularis also, if we are doing uvula manipulation and correcting the voice, the tension in the neck can be relieved if you use uvula for speaking. Your consciousness of uvula for speaking for a male voice. In older literature itself, there is a difference between uvular flexibility in male and female. In female, it is straight, it is going and touching the posterior pharyngeal wall. Sometimes it bends, okay. But in male, there is a knee-shaped formation. That is the main point we have to note. So there is a difference between in the uvula movement in male and female. That also we have recorded, but many needs to prove with ultrasound or MRI or some other methods by which we will be able to trace the sound level below the uvula and above the uvula. Above the uvula is more important in male voice production. So this we have to trace and find out. So number one, we are able to trace. Correct. Number able to trace the vocal cord and train it with just like athletes. Second thing is trauma, phonotrauma. We have to avoid. The third thing is we are more interested in knowing the tension of the neck, tension of the laryngeal inlet, tension of the thing. That more we know by endoscoping examination, phonatory tensions. So in some of the cases when they talk, the whole larynx collapse. Even the epiglottis come and sit over the laryngeal inlet, and what happened? This can damage the voice. So measurement of the tension of the neck muscles, okay, and inside also, inside the laryngeal inlet, the measurements also. There's so many theories are there, so many good postulations are there, and they are able to bring out a good positive response. What is happening to the voice in puberphonia also? But our feeling is these laryngeal changes can occur. It is nothing to do with puberphonia. Definitely, it is having its own advantage and disadvantage that it may have more action on it. Okay, so the third point is very clear. So that also we can measure and support the larynx and everything, which is the main point of treatment by speech therapists. Support the larynx outside, supporting their larynx inside, the air pressure also. Third thing is very important. Physiotherapists are also coming in this field. What are the anchoring for the voice? Even the scapular muscles, spinal muscles. So anchoring of the vocal cords also can be relaxed. That is why in America and other thing, other places, they say chiropractic also they are trying to improve the puberphonia. There are some literature published in the international journal. Boxing can relieve puberphonia. By doing boxing, it is a treatment for puberphonia. So, how physiotherapists are also involved in treatment puberphonia? The anchoring mechanism that is a very much essential for a good speech. It gives added strength. So, physiotherapists also may be a part in treating puberphonia. Not only laryngeal muscles inside and outs, but also other associated. Then the last is psychologists. Definitely, we cannot say psychological problem causes puberphonia or puberphonia problem created psychological things. But in our experience of treating 18 and 98 cases, we are still not getting the psychological doctoral psychiatrist support, because we are treating it as a fast track method. So there is no need for the psychologist to come and interview with the treatment aspect. And we are happy because our treatment is so fast and everything. So the without any psychology, they recover early. and we are attempting for a normal life. All are happy. Out of 10 patients, I just want to tell the public, out of 10 patients we are treating, one patient after the fifth day, on the fifth day, they will give treat to all the boys and to me also. Yesterday also I got cone ice cream. Usually I will try to avoid taking ice cold thing, but whatever maybe I have taken cone ice cream with them and so happy. So they are happy, we are happy. That is our so good to know about Puberphonia. So very soon we will have a good analysis of the cases and get a good support from all. Please subscribe it. We are happy to inform you every Monday we will have few ENT surgeons who are interested in knowing about, they can come to our hospital. They should be available from 11 to 6 o'clock. We'll demonstrate how we'll do, how they improve, how their behavior, and how we ought to do the follow up and everything. So we'll have a chance to teach them. So kindly subscribe it, then only everybody knows that. So first I thought we should have a conference and tell all the people. Now slowly I thought, teach somebody who is interested in learning. There will be good number of people. There are still my close friends are there. Out of 50 people in classmate in Madurai Medical College, still more than 20 people are there with close contact with them. I got a lot of students when I was a tutor, assistant professor, and civil surgeon and lecturer. So they will come and we'll have a bright future. Thank you. Meet next Saturday. Great. Thank you.